There is a sleeping position right now, tonight, that is silently strangling the blood flow to your heart and brain, and almost nobody over 60 knows they're doing it. Look, I'm about to tell you something that most cardiologists in America will never tell you in a 15-minute appointment. The position your body is in for the next 8 hours will either protect your heart or quietly set the stage for the stroke, the blood clot, the cardiac event that nobody saw coming. And here's the part that should stop you cold. 72% of all strokes happen during sleep or within the first hour of waking up. 72%. The most dangerous hours of your entire day are the hours you're lying in your own bed, completely unconscious, with zero control over what your cardiovascular system is doing. Now think about that for a second. You spend 1/3 of your entire life in this state. 1/3. And almost nobody, not your doctor, not your specialist, not the person who sold you your mattress, has ever sat you down and explained what your sleep position is actually doing to your heart, your arteries, your brain, every single night. Today, I am going to change that. Stay with me to the very end, because the one position that can cut your stroke risk by more than 1/3 is coming, but only after I show you the science. Because if I just tell you the position now, you will not believe it enough to actually do it tonight. And tonight is exactly when this needs to start. Hello, my friends. I am Dr. Wellness. And before I say one more word, I want you to know something about how I work. I do not make a single video without sitting with the research first. Peer-reviewed studies, cardiology journals, large population data sets, and 18 years of real patient outcomes. I do not chase headlines. I do not push products. I do not take money from pharmaceutical companies or supplement brands. What I give you is 100% my honest opinion, built on evidence, designed for one reason only, to help you live longer, sleep safer, and educate yourself enough to take back control of your own health. Because here is the reality. Nobody is coming to save your heart for you. Not the system, not the insurance company, not the 7-minute appointment. You are the one who has to make the changes. My job is just to give you the information so clearly that you cannot unknow it. So let's get into this, because what I'm about to share with you is something I genuinely wish every patient I have ever treated had known 20 years earlier. Here is what is happening inside your body right now, tonight, while you sleep. Your heart is beating roughly 60 to 70 times every minute, all night long, without a single break. Your veins are pushing blood from your feet all the way back up to your heart against gravity through vessel walls that, after 60, have lost a tremendous amount of their tone and elasticity. And here is something almost nobody talks about. After the age of 60, your body produces nearly half the nitric oxide it used to. Nitric oxide. That is the molecule the Cleveland Clinic calls the master regulator of vascular health. It is what keeps your arteries relaxed, open, and flowing smoothly. So picture this. Your blood is moving through tighter, stiffer vessels at slower speed with less natural relaxation for 8 straight hours. And slow-moving, pooled blood does one thing above all others. It clots. Researchers at Johns Hopkins have shown that deep vein thrombosis, that is, a blood clot in the deep veins of your legs, happens 3 times more often in adults over 60. And when one of those clots breaks loose, it does not stay in your leg. It travels into your lungs. That is a pulmonary embolism. Into the vessels feeding your brain. That is a stroke. Into the chambers of your heart. That is a cardiac event. All of it, starting from a position you held for 8 hours without ever knowing what it was doing. Now, let me ask you something. You wake up with swollen ankles in the morning? Do you feel more tired getting out of bed than when you got in? Do your legs feel heavy for the first hour of the day, like you're wearing invisible weights? If any of that sounds like you, type the word yes in the comments right now. I want to see it, because those are not random aging symptoms. Those are signs, clear, measurable signs that your circulation is being compromised every single night while you sleep. And later in this video, I'm going to give you a 15-minute pre-bed routine that drains that pooled blood out of your legs before you ever lie down. The data behind it honestly surprised even me. But first, let me show you why the side you sleep on actually matters at the anatomical level. Your heart does not sit in the middle of your chest. It sits slightly to the left of center. Your aorta, the largest artery in your body, the one carrying every drop of oxygenated blood to your organs. It curves to the left and downward as it leaves the heart. Now picture what happens when you roll onto your right side. That natural leftward curve of the aorta gets bent, Like a kink in a garden hose. Blood flow becomes less efficient. Your heart has to push harder to move the same volume of blood. Cardiology research from institutions like Harvard Medical School has shown that right-side sleeping increases nighttime palpitations in adults over 65 by nearly 28%. Not from disease, not from a structural problem, from mechanical pressure that should not have been there in the first place. Let me tell you about a patient. I will call her Shirley. 71 years old, retired school teacher from Ohio. She came to see me after almost a year of waking up at 3, 4 in the morning with her heart pounding. Rapid, irregular, terrifying. She had been to multiple specialists. EKG, normal. Holter monitor, normal. Echocardiogram, stress test, all normal. One cardiologist told her it was anxiety. Her primary doctor told her to cut the coffee. She walked into my office as a last resort, honestly expecting another shrug. I asked her one question that nobody else had asked. I said, "Shirley, which side do you sleep on?" She said, "My right side. My whole life, I have always slept on my right." I told her, "For the next 2 weeks, I want you to try sleeping on your left side instead." 3 weeks later, she called my office. The palpitations, completely gone. She was sleeping through the night for the first time in nearly a year. Now look, that was not a miracle. That was anatomy doing exactly what it was designed to do, the moment she stopped working against it. Now I need to show you the 3 sleep positions that are silently damaging hearts after 60. There is a very real chance you are sleeping in one of them right now. Position number 1, and this is the worst of all of them, stomach sleeping. Stomach sleeping is the single most cardiovascularly damaging position for an adult over 60. Why? Because your entire chest cavity is being pressed into the mattress. Your heart is being squeezed from the outside while it is trying to pump from the inside. Research from major American cardiology centers has shown that stomach sleeping reduces cardiac output by up to 23% and increases the workload on the left ventricle by 18%. Every single beat, working harder than it has to, for 8 hours, for years. That is how you weaken a heart muscle without ever realizing you are doing it. And on top of that, when you sleep on your stomach, you have to turn your head to one side just to breathe. That position compresses the carotid arteries on one side of your neck, the arteries feeding your brain. Studies have linked chronic head-turn sleeping to a 41% increase in stroke risk. 41%, just from the angle of your neck. Position number 2, flat back sleeping. Now this one looks innocent. People assume sleeping flat on your back is neutral, balanced, safe. It is not. Sleeping completely flat increases sleep apnea events in adults over 60 by 67%. And every single time your breathing stops, your blood oxygen drops, your blood pressure spikes, your vessel walls take damage. Repeat that 30, 50, 80 times a night for years. A landmark study published in the New England Journal of Medicine, following 14,000 seniors, found that flatback sleepers had a 39% higher rate of cardiovascular events compared to side sleepers. Now, I know what some of you are thinking right now. You are thinking, look, I have slept this way my whole life. If it was really that dangerous, I would already know. Here is the truth. The damage from a wrong sleep position does not announce itself. It does not send you a warning. It accumulates, silently, year after year, until one morning, the announcement is the stroke, the clot, the hospital visit. That is exactly why this conversation matters tonight and not in 5 years. Position number 3, right side sleeping. We already talked about the kinked aorta, but there are 2 more dangers I need to add. When you sleep on your right side, your liver, which is on the right side of your body and is one of your heaviest internal organs, presses upward against your heart. That pressure reduces how completely your heart fills between beats. Less filling means less blood pumped per beat. Your heart compensates by working harder. And there is one more thing, your lymphatic system. This is your body's drainage and detoxification network. It clears inflammatory waste out of your tissues. And in your body, it drains primarily on the left side. So when you sleep on your right, you are literally fighting your own drainage system. Inflammatory waste accumulates. Chronic inflammation drives arterial plaque, vessel damage, and ultimately, stroke. So, 3 positions, 3 mechanisms of silent damage. And every single thing I have just described, the aortic curve, the lymphatic drainage, the venous return, the nitric oxide deficit, the clotting conditions, all of it points in exactly the same direction. Your body has a preferred side. It has always had a preferred side. And the moment I tell you what it is not going to feel like new information. It is going to feel like something obvious you have always known but never had a name for. Sleep on your left side. That is it. That is the position. Left side, with elevation, with the exact setup I am about to walk you through. When you sleep on your left side, gravity assists your heart instead of fighting it. Your aorta is allowed to follow its natural curve. Research published through institutions like Stanford and the Mayo Clinic has shown that left side sleeping improves cardiac output efficiency by up to 17% compared to right side. Your lymphatic system drains freely, inflammation goes down, plaque buildup slows, clot risk drops, stroke risk drops. A cascade of protection, working for you every single night, automatically. Left side sleeping also reduces acid reflux, which protects your heart's electrical system through the vagus nerve. Now, if your doctor has never mentioned a single one of these things to you, do me a favor and hit subscribe right now, because I share exactly this kind of information every week, designed specifically for adults over 60. No products, no sponsors. Just the science and what it actually means for your life. But left side sleeping is only the first layer. What I am about to add to it multiplies every single benefit I just described, and it costs you nothing extra. Adding a modest upper body elevation, 15 to 20 degrees, changes everything. When your upper body is elevated, the pressure gradient between your heart and your brain shifts. Your heart works less hard. And here is something most people have never been told. Your nighttime blood pressure is a better predictor of stroke risk than your daytime blood pressure. Let me say that again. Your nighttime blood pressure is a better predictor of stroke than the readings your doctor takes in the office. Your blood pressure is supposed to drop by 10 to 20% during sleep. Cardiologists call that dipping. If it does not drop, or worse, if it spikes, you are what we call a non-dipper. Research published in the journal Hypertension showed that non-dippers have 2.5 times the cardiovascular event risk of normal dippers. And upper body elevation during sleep is one of the most powerful, drug-free ways to restore healthy nighttime dipping. A 6-year study following 9,000 seniors found that those who slept with their upper body elevated 15 to 20 degrees had a 41% lower rate of hemorrhagic stroke and a 36% lower rate of ischemic stroke compared to those sleeping completely flat. Let me tell you about Gerald, 74, retired engineer from Pennsylvania. For 3 years, his doctor had been managing his dangerous nighttime blood pressure spikes with 2 different medications. The readings were still not under control. But what Gerald did not say at his first appointment was that he was afraid, not in a way men of his generation say easily. He told me he would lie awake some nights, just watching the clock, wondering if tonight was the night something went wrong. His wife had moved to the guest room months earlier because she could not sleep next to that fear. The house, he said, felt quieter than it should have been. I explained non-dipping to him. I explained elevation. He went home and elevated the head of his bed using simple bed risers, the cheap plastic kind. 6 weeks later, his average nighttime blood pressure had dropped 19 points. His cardiologist reduced one of his medications, and his wife moved back into their bedroom. He looked at me and he said, 3 years of pills, 1 conversation with you. I wish someone had told me this earlier. So do I, Gerald. So do I. Now, I need to give you the complete setup because the position alone is not enough. Every element of this matters. Element 1, upper body elevation. Your entire upper body, not just your head, elevated between 15 and 20 degrees. Use a foam wedge pillow or bed risers under the head and legs of your bed frame. The head of your bed should sit roughly 7 to 9 inches higher than the foot. Do not exceed 25 degrees, or you will start sliding during the night and you will create lower back strain. Element 2, the knee pillow. Place a firm pillow between your knees. Without it, your top leg pulls your pelvis forward all night, compressing the major blood vessels through your groin and upper thigh. The knee pillow keeps your hips stacked, your vessels open, and your blood moving freely. Element 3, rib cage support. A small pillow or rolled towel placed under your left rib cage, just below the armpit. This takes pressure off your left shoulder and prevents you from rolling onto your back during the night. Element 4, head pillow height. And this is where I need to tell you about Norma. Norma is 78, a retired nurse from Tennessee. 3 different doctors had brushed off her symptoms. Every single morning, without exception, she woke up with a throbbing headache behind her eyes. 2 hours and 2 pain relievers just to get rid of it. Foggy mind until almost noon. They told her it was dehydration. They told her it was blood pressure. They told her it was just aging. She had been a nurse for 40 years. She knew something was being missed. When I asked her about her setup, here's what she described. She was sleeping on a wedge with 2 thick regular pillows stacked on top of that. Her head was elevated at nearly 40 degrees. At that angle, the arteries on both sides of her neck were partially compressed for 8 hours every night. Chronic overnight reduction of blood flow to her brain. 5 weeks after we corrected the angle, she walked into my office and before she even sat down, she said, "The headaches are gone. I wake up clear. My daughter says I seem like myself again." She had tears in her eyes. That was not complicated medicine. That was paying attention to the basics that everyone else ignored. So your head pillow must keep your spine in a straight, neutral line from neck to tailbone when you are lying on your side. Medium thickness for most people. Test it. Straight line, neck to tailbone. That is your correct height. Now stay with me for 3 more minutes, because the next element is the one that ties everything together. And the research behind it genuinely surprised me. During the day, blood and fluid accumulate in your lower legs and your feet. By bedtime, your legs are carrying a fluid burden that your cardiovascular system has to manage all night. When you lie down flat, all of that pooled blood rushes back toward the heart at once. Your kidneys respond by producing urine, which is the real reason so many people over 60 wake up 2 and 3 times a night to use the bathroom. In a lot of cases, that is not a bladder problem. That is a fluid distribution problem resolving inconveniently at 2 in the morning. Here is what to do. 30 to 60 minutes before bed, lie on your back with your legs elevated above your heart level. Use pillows, a wedge, your feet against the wall. Any version works. Hold it for 15 minutes. Gravity drains the venous blood back toward your heart and kidneys before you go to sleep. Research published in the Journal of Vascular Surgery showed this single habit reduced overnight venous pooling by 44% and measurably decreased clotting factors in the blood. And when you combine all of these elements together, left side sleeping, upper body elevation, proper pillow placement, and pre-sleep leg drainage, a 2023 study found the complete protocol reduced overall cardiovascular events, including stroke and pulmonary embolism, by 43% over a 3-year follow-up. 43%, not from medication, not from surgery, from the position of your body during sleep. Let me tell you about one more patient. Raymond, 69, retired police officer from Georgia. He had survived a pulmonary embolism, a clot that traveled from his leg to his lung, 18 months before he came to see me. He was on blood thinners. He was being monitored, but he could not sleep. Every time he closed his eyes, some part of him was listening, waiting, terrified that the next clot was already forming somewhere he could not feel. His doctors had treated the clot. Nobody had treated the conditions that helped create it. I walked him through the complete protocol. 8 weeks later, he came back looking different, lighter somehow. He said, "Dr. Wellness, for the first time since the embolism, I am not afraid to go to sleep." His blood thinner dose was reviewed and reduced at his next appointment. The chronic morning leg swelling that had been with him since the embolism was gone. He was sleeping through the night. He said, "I thought I just had to live with the fear. I did not know there was something I could actually do." That right there is exactly why I make these videos. Now, 3 mistakes I see over and over that will completely destroy your results. Mistake 1, using regular soft pillows for elevation. They compress during the night. You start elevated and you wake up flat. Use a real foam wedge or bed risers. Mistake 2, elevating only your head. Stacking pillows behind just your head while your torso stays flat creates neck compression, not elevation. Your entire upper body has to be elevated from below the shoulders. Mistake 3, trying to do everything on the first night. Decades-old habits need gradual replacement. Add 1 element every 3 nights. By 2 weeks, all of it will feel completely natural. So here's your action plan starting tonight. Sleep on your left side. Pillow between your knees. 2 or 3 firm pillows creating some upper body elevation. 10 to 15 minutes before bed, feet up above heart level. That is enough to begin. This week, order a foam wedge or bed risers, $40 to $70. Less than a single specialist copay, and it works for you every night for years. And I want you to make one commitment to me right now. 30 nights. 30 nights on your left side with this complete setup. Then come back to this video and tell me in the comments what changed. I want to know, did the morning swelling go down? Did the bathroom trips reduce? Did your energy come back? Tell me. I read every single comment. And listen to me carefully before I let you go. You are not broken. I know some of you have been told by doctors, by specialists, sometimes by your own family, that what you are feeling is just part of getting older. The swelling, the fatigue, the palpitations, the poor sleep, that this is just what 70 feels like. I am telling you as clearly as I can, that is not the full truth. A lot of what you have accepted as inevitable is mechanical. And mechanical problems have mechanical solutions. Your heart has not given up. Your body has not given up. Right now, in this moment, it is working with everything it has to keep you here. It just needs the right conditions to do what it was designed to do. Start tonight, even imperfectly. Left side, knees supported, upper body slightly elevated, legs drained before bed. That is enough. Your heart will feel the difference before your mind does. Now, I have one final request. If this video gave you something real, something your own doctor never told you, share it with one person. Think of someone in your life who has had a stroke, who takes blood pressure medication, who wakes up with swollen legs and does not know why. Send it to them. One click. You might be giving them something that changes their life. And down in the comments, I want to hear 2 things from you. Number 1, which sleep position have you been using all these years? And number 2, what is the first change you are going to make tonight? Type it out, be specific, be honest, because writing it down is the first step to actually doing it. And if you have ever had a stroke, a TIA, a clot, or any cardiac event, share your story too. Someone watching this video right now needs to hear that they are not alone. If you are new here, subscribe. Every week I bring you clear, honest, evidence-based health information designed specifically for adults over 60. No products, no agenda, just the truth and what to do with it. Sleep well tonight, my friend. Maybe for the very first time, you finally know how. This is Dr. Wellness, and I will see you in the next one.